Intertransverse and Scalene fascial separation. This technique can be performed with a thumb, middle finger, or index finger. Use whichever hand position and fingers are comfortable for you. Begin just beneath the mastoid process. Take a few moments to let your finger or thumb sink into the tissue. Use the other hand to gently support the head on the opposite side. Then press medially toward the spine as you begin your descent toward the shoulder. Whenever you feel a restriction, wait in that area, keeping your pressure constant until you feel the tissue give way. Then continue your slow movement downward along the line of the transverse processes. You are working on the fascial covering of both the scalenes and the intertransverse ligaments. When you reach the base of the neck, begin again, this time starting at the base of the neck and moving upward toward the skull. After you've performed several of these strokes, or after you feel the tissue resistance has sufficiently diminished, move on to horizontal fascial separation across the intertransverse ligaments. Place your finger or thumb anterior to the transverse process. Sink in and move posteriorly. You may need to support the skin with the other hand in order to do this. Repeat this at every level. Then perform the same stroke from the posterior to the anterior aspect at each level. This is easier to do with the pads of your fingers than your thumb. Use your other hand underneath to support the skin if necessary. Talk to your client as you perform these techniques. Ask how the person is experiencing each movement. One particular direction of fascial stretch may be more useful than another. Often some will be clear and others will be fairly restricted. After you've had more practice, you may be able to tell without asking the client at all. But in the beginning, I suggest keeping up a continuous dialogue about the client's experience. By enabling your clients to help set the boundaries of your work, you're giving them a greater sense of participation in the healing process. This can be very empowering. Clients often feel powerless to help themselves.